But people still have to talk to each other, right? I know, ma'am, I know it was an urgent situation and lots was changing, but people still have to talk to each other. People still send emails back and forth. In times of urgency, I would expect there would still be a lot of communication happening, and yet there's such an absence of information. Are you concerned about the destruction of documents, especially with reports alleging Mindone destroying a large number of emails? And I know that wasn't PHAC, but are you concerned about destruction of documents within the Public Health Agency of Canada?
I agree with what the Auditor General has recommended, which is that documentation needs to be provided and to be maintained on file, so that when you have change and turnover in personnel, those records are maintained.
That's not really an answer to my question. Can I just quickly flip over to the Auditor General? If you can confirm your previous testimony, the complete absence of documents suggests that either there was a conspicuous lack of records kept, or the documents were destroyed. That one of those two things happened, but you weren't able to confirm which. Is that correct?
Well, when documents don't exist, it's either they never existed or they were destroyed. So, and in this case, we can't tell you which it was, but there is a glaring lack of documentation that should be maintained.
Thank you. Back to the President. The app went through 177 different versions, most of which weren't properly tested. You owned the app, so why weren't different versions of the app tested? Why did you not insist on proper testing of the app?
In their testimony that in order to increase the speed by which the versions would be deployed, that they were not all tested.
So you were aware at the time that they weren't being tested, and you were okay with that?
The governance around the project management at the time looked at how the apps were being deployed. And
sorry, I'm looking for clear. Ma'am, I have limited time, and I'm looking for clear answers to clear questions.
I'm going to turn to my colleague Luc Brisbois from the Border Services.
No, I want to hear from PHAC. Over 10,000 people were falsely sent into quarantine because this app was, in most cases, not properly tested. Are you comfortable with that? And did you brief the minister about the lack of testing?
So it's very regrettable. We're obviously not comfortable when people are erroneously advised. In this case, when they arrived in the country, they were given a green check mark, which means they are cleared for entry without isolation periods. There was then an error in the app that resulted in messages being sent out. The Public Health Agency
I'm asking about the
Generous, that is
Are
your
you
time.
comfortable with the lack of
Mr.
testing?
Generous, that is your time.
Public Health gave a non-competitive professional services contract to KPMG, and on that, the Auditor General said, quote, "We found no documentation of the initial communications or the reasons why the agency did not consider or select other eligible contractors to carry out the work," end quote. Is that correct, Ms. Hogan?
Yes, you've quoted the part of my report, yes.
Ms. Jeffrey, how much was that contract for?
The original contract was issued by PSPC as one of the 7 companies that were available under the COVID Emergency Professional Services. The total amount that was contracted with KPMG through the 3 different contracts was $4.5 million.
Just the date, please. When was it completed?
I'm going to turn to Martin Cremens to talk about the dates.
Yes, the initial contract task authorization through PSPC was awarded and signed on September 29th, 2020 for a value of $518,000.
What was the benefit that taxpayers got from this contract?
Of KPMG in this contract was really to do the work to assess the industry impacts and the traveler journey using the app. So the app had to be deployed in an airport environment, working with air services and the aerospace industry. And so they were looking at the process maps, at the journey maps, at the rollout and other implementation around
so this contributed to the at least $60 million price tag, yes?
The
This
auditor,
contract?
no, the $59 million associated with the contract were related to the development of the app and its technology. So these were
Additional
part
costs.
of support services related to border measures that that included a wide variety of different measures at the border.
So additional costs.
Yes, these are additional costs related to the implementation of border measures.
The Auditor General said that there was no documentation found on the initial communications on this contract. So who called who?
The contract has a sole source justification on file that identifies the expertise of the vendor in aerospace services, in administering public health and health projects at the municipal, provincial, and
So there are
local level.
documents to support their selection?
There is a sole source justification on file, but there is no documentation of the initial contact with the company.
Okay. So who contacted who? It's pretty straightforward. Either KPMG called you or you called KPMG.
There's no documentation on the file. They were chosen from a list of pre-qualified contractors that
called
was
KPMG.
established by the Public Service, by Procurement Services Canada, PSPC. So PSPC
Called KPMG.
would have made the initial contacts with those
The Auditor
companies to
General
establish
said,
contracts
and I
with them.
quote, while the first contract included milestones with clear deliverables and pricing, these were later amended and replaced with less specific deliverables to allow for more flexibility. In addition, the agency did not set out specific tasks, levels of effort, and deliverables for these contracts in task authorizations, end quote. Ms. Jeffrey, did Public Health reduce the deliverables required by KPMG, one of the largest firms in the world? Was there a reduction in the deliverables, yes or no?
There was no reduction in the deliverables.
Okay. I'm going to turn to the Auditor General. Ma'am, your report says the opposite of what the president of the Public Health Agency has just said. And I quote your, should I quote your report again, or you've got, you know what you said. Okay.
I can read it back to you, yeah.
Okay.
No, there were deliverables. The deliverables were then relaxed, right?
Right.
They were very clear, and
Right.
then they were made less specific in order to provide flexibility.
Right. So that's
You got about 40 questions, 40 seconds. Just
okay. So we have the Auditor General. I read what she had written. She repeated what she wrote. What you said, Ms. Jeffrey, is not consistent with that. The requirements were relaxed of KPMG by Public Health, one of the largest firms in the world in KPMG. How is it that the government sets specific criteria, then goes back and creates less specific criteria? So, like, I would want to know why the government would want to do that, because we know what the result is going to be: higher costs for taxpayers and less accountability for Canadians. How can you possibly justify that?
So, Mr. Chair, what I can say is there was no reduction in the amount of work that was required for the deliverables. Yes, the categories of the work that was being done were broadened, and the Auditor General has pointed out that that meant that they were less specific. However, that was done in response to a rapidly evolving pandemic, for example.
Which
with
the Auditor General
onset of
also
the-
said was not an excuse
and that,
to
Mr.
relax
Barrett, that
the
is your
rules.
time, I'm afraid. Turning out to